The world is in a very dangerous period of the COVID-19 pandemic, compounded by more transmissible variants like Delta, which is continuing to evolve and mutate. That, according to the World Health Organization Director General Tedros Adhanom Ghebreyesus, and he warned this. Let's listen in.
Patterns. Listening us, we're in a very dangerous period of this pandemic. In those countries with low vaccination coverage, terrible scenes of hospitals overflowing are again becoming the norm. But no country on earth is out of the woods yet. The Delta variant is dangerous and is continuing to evolve and mutate, which requires constant evaluation and careful adjustment of the public health response. Delta has been detected in at least 98 countries and is spreading quickly in countries with low and high vaccination coverage. This week, WHO hosted a two-day summit with heads of state, heads of government, ministers, and civil society leaders from small island developing states, SEEDs, which focused on building resilient health systems in the face of multiple threats. Climate crisis, the severe impact of the pandemic on lives and livelihoods, vaccine inequity, and the large burden of non-communicable diseases were discussed and concrete outcomes developed on how together we can tackle them. On an almost day-to-day basis, we are now seeing the impact of the climate crisis. Record-breaking, scorching heat waves, catastrophic storms, and changing weather patterns are impacting food systems, disease dispersion, and societies at large. The time for lofty words is over. There needs to be concerted action backed by financial resources to mitigate the consequences of climate change while we work to keep temperatures down and scale green innovations.
And we know too that one of the consequences of climate change is the fact that more pathogens will be released, and the likelihood of having future pandemics within a shorter period of time, maybe every several years, every decade, is likely. And that is one of the reasons to why we have to prioritize the issue of climate change in order to protect the planet, and at the same time, even to control or to reduce or eliminate, for that matter, the pandemics that may follow in the future.
The WHO chief further said that he had already urged leaders across the world to ensure that by this time next year, 70% of all people in every country are vaccinated. That would, he said, effectively end the acute phase of the pandemic. The WHO chief noted that 3 billion doses of vaccine had already been distributed. Of the vaccine doses given globally, fewer than 2% have been in poorer countries. And although rich countries, including Britain, the United States, France, and Canada, have pledged to donate 1 billion vaccines, WHO estimates 11 billion doses are needed to immunize the world.
Going back to the Philippines,